Hi everyone, my name is Dr. Sara Arian. I'm a double board certified reproductive endocrinology and fertility specialist at Boston IVF. I see patients via telehealth for virtual consults all over the state of Massachusetts, as well as the states of Texas and California. And I'm available for in-person visits and consults over at our Boston IVF Quincy South Shore office. Today I am going to discuss about a topic that I frequently get asked about, and some patients sometimes have concerns about, and that is ovarian cysts and what are some of their impacts on an individual's fertility. So what is the definition of an ovarian cyst? An ovarian cyst is a fluid-filled sac, a fluid-filled structure that is filled with some type of fluid or liquid that can really form anywhere in the body, but can also form inside or on an ovary. And when we talk about ovarian cysts, in general, they are categorized into benign cysts as well as precancerous or cancerous and malignant cysts. And the focus of today's talk is going to be mainly benign cysts, and I am going to go over some of the most common benign ovarian cysts. These include functional ovarian cysts, hemorrhagic cysts, dermoid cyst, endometrioma, and I will also talk a little about polycystic ovaries or polycystic ovarian syndrome. So what is a functional ovarian cyst? During a woman's menstrual cycle, there are follicles within the ovary, as one follicle is growing under the effects of hormonal signaling from the brain, the egg within the follicle will continue to grow and become mature. At the time of ovulation, again under the impacts and effects of the brain hormones, the follicle will rupture and the egg within the follicle will get released. Now, if at the time of ovulation the follicle does not rupture, it can later form into a cyst that is also known as a functional ovarian cyst. So a functional ovarian cyst, which is also known as a simple ovarian cyst, is oftentimes small, benign, and these cysts are very common. They come and go throughout a woman's menstrual cycle, and oftentimes they do not require treatment as they are small, asymptomatic, and they can go away on their own. Sometimes for larger cysts that are persistent or maybe causing some mild symptoms, we may want to monitor these cysts by performing regular serial ultrasound examinations. And sometimes in rare cases, if the cyst is large or persistent or causing some abdominal and pelvic pain, we may try a short course of oral hormonal pills or contraceptive pills. And these pills suppress ovulation, and they can sometimes help with shrinking the cyst and also prevent from future cyst formation. Now let's talk about a hemorrhagic ovarian cyst. This is a fluid-filled sac that is filled with blood. And a hemorrhagic cyst can form and result from bleeding into a ruptured follicle. These cysts, just like functional ovarian cysts, are also benign, oftentimes small, pretty common, and oftentimes asymptomatic, not requiring any treatment. And in some cases, if these cysts become large, in rare cases, they may cause some symptoms such as abdominal pain and pelvic pain, sudden onset of severe acute abdominal pain, nausea, vomiting, and vaginal bleeding in rare cases. If the size of the cyst is large, the cyst can be at risk for rupture, causing internal bleeding and blood in the abdomen. It can also increase the risk for ovarian torsion, which is twisting of the ovary around its stalk, and that can cut off the blood supply to the ovary and oftentimes becomes a surgical emergency. So in these cases, surgical removal of the cyst may be warranted for a hemorrhagic cyst. Another type of ovarian cyst is called the dermoid cyst. And dermoid cysts are very interesting. These are also known as ovarian teratomas. These are germ cell cysts that are caused by undifferentiated germline cells or germ cells. This is a cyst that contains various types of tissue within the cyst. So there could be hair and nail and cartilage, bone and skin and fat and fatty cells found within the cyst. Dermoid cysts are also common in individuals during their reproductive years, and oftentimes small, asymptomatic, harmless, and not worrisome. And they oftentimes do not require any treatment. Sometimes if the cyst is continue to grow or become larger in size, we may continue to monitor the size of the cyst or the growth of the cyst over time by performing ultrasound examinations. But in rare cases, they can become symptomatic and can sometimes cause symptoms of abdominal and pelvic pain and pressure, pressure on structures such as the bladder and the rectum, or in rare cases, irregular menstrual cycles. If the cyst becomes large in size, and this is typically for cysts that are larger than 5 centimeters in size, the cyst can be at increased risk for rupture and spillage of the contents of the cyst that can result in infection or chronic inflammation. There is also risk for, again, ovarian torsion and twisting of the ovary, as well as very rare cases of possible malignant transformation of these cysts. And in these cases, surgical removal of the cyst may be indicated and warranted. Next, I'm going to talk about endometrioma. An endometrioma is an endometriosis cyst or an endometriosis-related cyst. Endometriosis is a chronic pelvic inflammatory condition that is also common in many individuals during their reproductive years. And with this condition, there is presence and growth of endometrial tissue and endometrial cells outside of the cavity of the uterus and outside of the uterus. If there is a presence of these endometrial cells and tissue within the ovary, that can result in formation of an endometrioma, which is an endometriosis cyst. And just like I said, these cysts contain endometrial cells and tissue, as well as old blood, and are sometimes also known as chocolate cysts. Presence of an endometrioma indicates severe stage 3 or stage 4 endometriosis. And unfortunately, these cysts can sometimes cause symptoms such as abdominal pain, pelvic pain, chronic pelvic pain, pain and difficulty with intercourse, pain with bowel movements, and chronic constipation. They can also cause scarring of the ovaries and the fallopian tubes, resulting in drop in your egg count and sometimes impacting fertility, causing subfertility or infertility. It is extremely important that you discuss a comprehensive plan for management of endometriomas with your fertility physician, because surgical intervention is not always indicated for an endometrioma. And surgical removal of an endometrioma may be a complex, complicated surgery because there could be a risk for possible scarring and damage to the normal ovarian tissue that can further result in dropping your egg count. Surgical removal of an ovarian endometrioma is sometimes indicated in cases where the cyst is large. We're talking about cysts that are larger than 6-7 centimeters in size, or are continuing to grow and causing severe symptoms, or for patients with infertility who are preparing to undergo IVF. Presence of an endometrioma that is pretty large that might prevent access to the ovaries at the time of IVF and egg retrieval may require surgical removal of the endometrioma. Again, it's important to discuss with your fertility specialist and come up with a comprehensive plan for managing an endometrioma. Lastly, I am going to talk about polycystic ovaries or PCOS. This is also a very common hormonal reproductive disorder, also known as polycystic ovarian syndrome. And polycystic ovarian morphology or polycystic ovaries is really an ultrasound finding that is a common feature of many individuals with PCOS. On the ultrasound, in individuals with PCOS and polycystic ovarian morphology, we see lots of tiny little follicles, antral follicles, within the ovaries containing eggs. And the name PCOS is misleading, as these follicles are not really cysts. So the ovaries do not contain any cysts. These are rather follicles, and most people with PCOS and PCO ovarian morphology have a very high follicle count with lots of tiny little follicles within their ovaries. And this can give the ovaries the appearance of what we call a chain of pearls. It's important to note that, once again, this is just a finding. It may not necessarily cause any signs and symptoms in PCOS, and these follicles are benign. They do not require any treatment or continuous monitoring. They are harmless and not worrisome. How do we diagnose an ovarian cyst? Ovarian cysts are diagnosed based on physical examination, pelvic exam, and we oftentimes use different types of imaging studies, including ultrasound evaluation and examination of the ovaries, as well as CT scan, and in some cases, MRI. It is very important to note that most ovarian cysts are benign and harmless and asymptomatic. And oftentimes we just proceed with watchful waiting, and we may sometimes continue to monitor the growth of the cyst and development of any symptoms over time. But most of these cysts do not require any medical or surgical intervention. Surgical removal of a cyst may be warranted in cases where the cyst is continuing to grow and become large, when there is an increased risk for ovarian torsion. And also cysts that are causing severe symptoms and making patients symptomatic, as well as any time that we are concerned about precancerous cyst or a malignant cancerous cyst, as well as cysts that are formed and developed in postmenopausal women after menopause. These are some of the common reasons for performing surgery and surgical removal of these cysts. Some of the signs and symptoms that may be concerning for ovarian malignancy or a cancerous cyst may include chronic pelvic pain, abdominal pain, sudden onset of severe abdominal pain, as well as general fatigue, weight loss, GI symptoms, nausea, vomiting, loss of appetite. Also having a strong family history of early onset of ovarian or breast cancer that may require further investigation. In summary, it is very important to have a conversation with your fertility specialist. Different cysts, depending on their type as well as their size, can have varying impacts on an individual's fertility. And it's important to have this conversation with your physician and come up with a comprehensive plan to take care of and manage these ovarian cysts.